Very good morning to you. Let's elaborate a little bit more about the Cuban medical staff that's here. I mean, a lot of people are questioning, understandably, why South African talent wasn't used initially.
Good morning and good morning to your viewers. We are using South African talent every day. We are investing a whole lot of assistance and also invoking a lot of innovation from different levels of our healthcare workers across the province. And it's something that we are still going to do, and we are committed to doing, because we cannot fight the pandemic alone. We need to make sure that we don't also get a bit jittery, when we enlist a lot of assistance from other parts of the world.
I'm sorry, I should have been more explicit. Those thousands who are unemployed, who are sitting at home, who don't have jobs. We heard last night that there's been a call for doctors who are unemployed or who've retired to come forward. So shouldn't we have looked there first?
We have, in actual fact. I think from last year, even before the pandemic, we did put out a blog advert as Gauteng Department of Health, which actually enabled all our institutions and facilities to be able to employ more health practitioners, and including nurses. At the beginning of April, we also launched our digital health portal, where people can be able to apply for jobs online. And like I said yesterday, we have received over 8,000 applications, which we are processing at the current moment. And it's something that we are going to continue doing. Our commitment as a Department of Health is to continuously build capacity that will stay with us even beyond the pandemic.
All right. And can you address the concerns about how much they are being paid? There are reports out there that it's possibly 3 times as much as South African talent, including the flights and the accommodation and food allowance they are getting. I mean, is this something that we could then roll into what we have already working in South Africa?
I think there's a big issue about that, but I subsequently think that we need to be able to understand that any assistance will come at a price. It's like people want us to even talk about the prices and the cost of the PPE that we buy, but it's an investment that we're doing to save the lives of our South Africans. It's an investment that we are putting in making sure that we're able to fight the pandemic. Beyond the pandemic,
can you confirm to us how much it is they are getting paid? Give us a sense of the figures out there.
I wouldn't be able to do that currently, because it's something that has been figured out, and usually the payments that get paid to such delegations is usually government to government, and it's not to government to individual. So it might not be an individual payment that goes to an individual practitioner or epidemiologist as they are coming, because there are different levels of categories of healthcare workers there. It's not only doctors. There are people who are going to help us try to understand how to strategize in dealing with issues like this. Countries like Cuba, they have always annually able to deal with pandemics or deal with disasters as it were. And as a country, we don't have enough events. But we are learning, and we have bought a lot of assistance from our own South African experts.
Okay, I mean, it's good to know. I know that we're going to be looking outside our borders for loans, but it's good to know that the money is there, it is available, and it can be pumped into the right places. I mean, I should imagine that this is yet another learning curve that we can take post-COVID-19.
Yes, like the issue that we have said before is that this is a big opportunity for us as a country, as a province, to build capacity. You would remember that beginning of the year, we're talking about implementation of universal health coverage. So we must take the opportunity, a silver lining that comes with the pandemic, to be able to fast track some of the reforms, to fast track some of the things that we needed to actually implement, like your building of capacity in terms of extra beds. We also said that we want to build capacity in terms of human resource. So we are quite confident that we are not going to neglect our South African doctors. We are not going to neglect our South African nurses. In actual fact, we get disappointed when they are not as.
Okay, MEC, I'm going to have to cut you short there because your sound is coming and going, but very good to talk to you. Thank you for the update.